This Focus on Health segment is brought to you by Aurora Healthcare.
Welcome back to Oshkosh Today. I'm Jill Wunrow, and on this Focus on Health segment, we're here to help you live healthier and feel better. We are proud to be at Aurora Medical Center today to tell you about pain-relieving methods for back and neck problems that's helping many people get back on their feet, out of the house, and living a life that they thought would never happen again. Dr. David DeWitt of the Neurospine Center is joining me here now to talk a little bit about this, I guess, not really new procedure, but how people can actually prevent going into surgery and helping their back out in the future. Is that correct?
That's correct.
And tell us a little bit about yourself.
I'm an orthopedic spine surgeon, which means I did general training in orthopedics to do hip and knee replacements and things like that, but I did extra training in how to do just spine surgery, and that's what I focus on now, is doing primarily spine surgery, so neck and back surgery. Okay,
great. And what are the chances someone will need spine surgery?
Well, the chances of somebody having a back or neck problem is pretty high. Almost everybody's had a back or neck problem at some time. Over 50% of adults will actually go to see a doctor about a back or neck problem. But the truth is that only about 1 in 100 actually needs a spine surgery. So there are a lot of disease entities out there or problems out there that don't require surgery to get better.
Okay, and why should people have to try other things before having surgery and just, going right to the operating room?
Well, like I alluded to, a lot of people will have a back or a neck problem that is a non-surgical problem and can get better with conservative care. Things like chiropractic manipulation, physical therapy, injections, medication management. And if patients have a non-surgical problem that we can get better, then that's what they should try before surgery. The other thing to think about is a lot of people will get an MRI scan or some type of an imaging study, and those imaging studies can show something that isn't completely normal anatomy, but it could be an asymptomatic problem. If you get people off the street that have no back or neck problems at all, they might have some abnormal findings on the MRI, which means you have to consider that some of these things you're seeing on the MRI scan may just be normal variants or may not actually be causing their pain. So when we talk about non-operative care, we do things like injections and therapies. If it gets them better, great. If it doesn't get them better, we have a much better idea at what's causing their pain, and then when they do end up seeing the surgeon, we know that they have a problem that needs surgery, and we do the right operation to take care of their pain. So it makes us much more successful surgeons when they've had a good preoperative, non-surgical course of treatment.
But then you have those people that are just like, well, if I go through all this preoperative things, I'm just delaying the inevitable. Is that true, or?
Yeah, some people feel that way, and in some cases, their non-operative course is much shorter than others. But those are people that have a very clear-cut surgical problem. They don't need anything else diagnostically to tell us what's causing their pain, and they're having very, very severe symptoms. Those are people that will get to surgery quicker. But like I said, the chance of us doing the right surgery is much higher when they've had, preoperative, non-surgical management first.
You talked a little bit about symptoms. Talk a little bit about arm and leg symptoms. How does that all going? Some people don't understand how that's in conjunction with your neck and your spine.
People would say, well, I have pain in my arm or my leg, how can that be a back problem? And the reason is because the nerves that go down the legs and down the arms start inside the spinal canal. So if as those nerves are passing out of the spinal canal, something is pressing on them, like a disc or a bone spur, or they have some instability in the spine that's compressing the nerves, that will send pain where that nerve goes, which is down the arm or down the leg. So that's why they feel symptoms in the arm or leg when it's actually a back or a neck problem.
And when is surgery indicated for back pain?
Actually, for just pain in the neck or in the low back, there aren't that many things that benefit from surgery. Some things include tumors, fractured bones, infections. Those are things that are a little bit more rare but do require surgery. And other things like degenerative disc disease, which is a wear and tear that develops usually in the lower discs in the back. And that's typically in a 30 to 50-year-old age range. And they've got to meet kind of very specific criteria for MRI findings and history and complaints. and those people might meet the criteria for a fusion operation, but for the most part, we don't do a lot of surgery for just isolated neck or back pain. That's much better managed with non-operative means.
What types of problems or medical problems can require a spinal fusion itself?
Fusions are done for, like I said, degenerative disc disease problem where the disc is worn out and the disc is actually a pain generator. It's also done in cases of instability, and that's the primary use of a fusion. So if the spine has developed from a fracture, from trauma, or from a wear and tear process or a defect in the bone, it's allowing the spine to shift back and forth, causing a problem. That's when we want to stabilize the spine, and we do it provisionally usually with a metal implant of some sort, but ultimately we want the two bones that are unstable, we want those to heal together to cause a more permanent solution to the problem, and that's a fusion.
Okay, and at what point do people decide to seek treatment? With so many options for back pain, who should they see?
Yeah.
Obviously, besides yourself.
Yeah, well, you wake up with a stiff neck, you take some anti-inflammatories and the pain goes away. That's not a person that probably needs further evaluation. But if the problems are more persistent or they're more severe, people will usually seek treatment primarily through their chiropractor, through their primary care physician. But if they want to have an evaluation through a spine center, they're more than welcome to call our office as well. Most of the referrals we get are through chiropractors and primary care physicians, but patients can get direct referrals to our office. So if somebody that has a persistent problem or a disabling problem, they should probably seek some type of evaluation.
All right, I actually just went to a chiropractor today. I'm glad I'm doing the therapy thing rather than just going right to the surgery. Thank you so much for joining us
Exactly,
today.
my pleasure.
And you don't have to travel far for back and neck pain relief. There are a variety of spine procedures that can be done right here in Oshkosh. For more information on those procedures, you can visit the Neurospine Center online at www.neurospinewi.com, or you can contact their office at 882-8200. Thanks for joining us for another Focus on Health segment. I'm Jill Wunrow. Make it a great day.
This Focus on Health segment has been brought to you by Aurora Healthcare.